Patient care environments. What do CNAs do in each setting? A presentation brought to you by 4YourCNA.com. Hi. In this lesson, we will discuss some common healthcare settings and what CNAs do in each one. There are a lot of places that a CNA can work, and every one will have different work responsibilities. In this lesson, we will discuss different work environments and what you might expect to do in each one. We will cover home care, adult daycare, assisted living, hospitals, rehabs, nursing homes, mental health centers, and outpatient settings. There are many other places that a CNA can work, but we will focus on the most common in this presentation. We'll start with patients that need the least amount of care. Most people will live at home throughout their entire lives. Even if someone is ill or injured, they can often continue to live at home. Most people prefer to remain in their homes. It's comfortable there. It's familiar. It's set up exactly the way you want it. And most importantly, you get to live your life as you see fit. Get up when you want, eat when you want, sleep when you want. In your own home, you set the rules. Even as they age, many older people will remain in their homes. It's important to understand that many older people live at home with no assistance other than a spouse or family member. But sometimes a spouse or family member isn't quite enough help. Many times, help initially comes in the form of friends and neighbors. Friends may drive a person to appointments or go get groceries for them. Neighbors may bring over meals or care for the lawn. There are many people who have a great support system in place and never need any outside assistance. But for some people, this system may not be effective. Sometimes friends and neighbors are not reliable because they have their own obligations. Or maybe the tasks the person needs help with are just too personal for neighborly help. In these cases, people often hire someone to come in and help. This is called home health care, and it's the fastest growing segment of healthcare in America. Home health care can be very simple to very complex, depending on the needs of the client. Some clients will need help with cooking and light cleaning and running errands, but not personal skills such as bathing. These clients will hire a companion. Companions are hired assistants that cannot perform any hands-on care. Some clients will need help with personal skills, such as bathing, but don't need nursing skills, like taking vital signs. These clients will hire a home health aide. HHAs are hired assistants that perform hands-on personal care that does not require nursing knowledge. But some clients may have complex medical needs, such as catheters, prosthetics, oxygen canisters, etc. These clients will hire a certified nursing assistant or CNA. CNAs are hired assistants that can perform more advanced nursing skills and work closely with the nurse to manage the patient's care. CNAs perform vital functions in home care. You're often the only person to see the client on a regular basis. In this setting, you have to have good observation skills and report changes quickly. CNAs that work in home care devote all of their time to one client. You have to be able to work with families and be flexible, doing things the way the client wants them done. This is generally a slower-paced job with little direct supervision and requires a self-motivated individual. And CNAs must respect that they are in another person's home. Diplomacy, good manners, and tact is a requirement for this setting. If you're the type of person who works well alone, likes routines, enjoys a slower pace, and wants to spoil your client with a lot of personal attention, this might be the job for you. All of these assistants generally work for some sort of home health agency, nurse registry, or companion service, which oversees scheduling, coordinates care, resolves conflicts, and handles payment. Some home care can be paid for by insurance, but most home care is private pay, which means the clients are completely responsible for the bill. These caregivers allow the client to receive the services they need while allowing them to remain at home. Home health care can be provided in a wide variety of formats, from short visits of less than an hour to shifts of 4 to 8 hours to live-in caregivers, depending on the needs of the client. For short-term care provided in periodic visits, this can be a relatively cost-effective way of meeting the client's needs. But since the care is one-on-one, it can quickly get expensive if the client needs continuous care. And there are other issues as well. Home care providers may perform light housekeeping tasks, but they do not do deep cleaning, so homeowners often have to hire a cleaning company. Home care providers may prepare light meals and snacks, but they're not a meal service, so homeowners without a family support system often have to have meals delivered. Home care providers won't take care of the lawn, and they can't perform home maintenance, so homeowners may still have to hire a lawn care company and a handyman. So for some clients, maintaining a home, as well as paying for in-home care, can pose problems, both financially and physically. For clients that remain in their home, it can be a full-time job coordinating helpers for house cleaning, lawn care, transportation, personal care, meals, and more. Some clients cannot remain at home continuously, either because of financial or caregiver conflicts, but they don't want to leave their home permanently. These clients often consider receiving care in a facility for a few hours each day to meet their needs, allowing them to return home each evening. An adult daycare, like the name implies, is a congregate facility that clients go to for a certain amount of time each day, but return home each evening. This is useful if a client cannot remain home alone, but the primary caregiver has to work or go to appointments. It also provides socialization opportunities and entertainment for clients that would otherwise be alone most of the time. There, they can receive personal care services, entertainment, socialization, and monitoring for extended periods. And because it is not one-on-one care, it's usually less expensive. Adult daycares can be standalone facilities like child daycares. But most often, this service is provided in an existing assisted living facility or nursing home. These staff members will care for both their residential clients as well as the adult daycare clients. But this solution only works for a few hours each day. When the client begins to require more care, more often, some families start thinking of a more long-term solution. For some clients, this might come in the form of an assisted living facility. An assisted living facility, or ALF, combines all of the features we have covered in home care and adult daycare, but in a more convenient long-term form. An ALF is a residential setting, meaning the person moves in and lives there permanently. The resident rents an apartment, either privately or shared with another resident. The facility provides an apartment, meals, laundry service, housekeeping, maintenance, and activities for one single monthly fee. Some facilities also offer transportation services as well. Personal care can be provided by staff members at a contracted rate. Rates will be determined by the type and frequency of the care needed. Most of the care is non-medical personal care, such as assistance with bathing, dressing, grooming, getting to meals, etc. Because most care is non-medical, there are no special qualifications or certifications required for those providing care. On-the-job training is considered to be sufficient for these settings, and these caregivers are often called resident aides. However, many facilities prefer to hire home health aides and CNAs to provide care. ALFs are not required to have nurses on staff because the level of care does not require nursing intervention. Because of this, ALFs are not a good option if the resident has medical needs, such as catheters, wounds, is bedbound, or has a feeding tube. And it often means that the resident must move again if their health declines. Assisted living is usually not paid for by insurance. Residents must pay out of their pocket for these services. In many cases, residents sell their primary homes to offset the cost of assisted living. But this option is often less expensive for those requiring frequent care. In recent years, some assisted living facilities have begun offering limited nursing services as well. In an effort to keep residents from having to move again when they need more care, additional services can be offered in this setting, depending on the type of ALF license that the facility has. If an ALF has a limited nursing license, the facility will employ nurses to manage the resident's medical care. and they will also employ CNAs to help care for the residents with advanced medical needs. So CNAs that work in an ALF setting may be providing personal care, such as bathing, grooming, feeding, etc., and possibly nursing tasks, such as vital signs, caring for catheters, assisting with nursing procedures, etc. CNAs that work in an ALF usually care for the same residents day after day. They develop relationships with those residents. This is a routine-dominated environment. The residents and the care they receive rarely changes. Since most of the care revolves around activities of daily living, such as bathing, grooming, dressing, becoming familiar with the residents' routines will be the biggest challenge. If you like a structured environment, working with coworkers, enjoy routines, and prefer a consistent work environment, working in an ALF might be right for you. When a resident in home care or an assisted living facility has an immediate health problem, they often go to the hospital, just like you and I. Hospitals treat acute problems, short-term problems that came on suddenly, or chronic illnesses, long-term problems that need to be stabilized. Hospitals employ nurses to manage those illnesses and injuries, and they hire CNAs to help the nurses. This is serious medicine. The care is short-term, usually lasting only a few days, and will involve many team members. There are many departments, many tests, many procedures, and many treatments happening here, all at the same time. This is an incredibly fast-paced environment, and one that is constantly changing as patients get admitted and discharged. The health of patients here can change rapidly as well. Today, your patient can't brush his own teeth, but tomorrow he will. In a hospital, CNAs will help patients with personal care tasks that they can't do themselves, like toileting, bathing, and grooming. But we also encourage independence, so the patient that can perform self-care activities will continue to do so. But CNAs will also watch those patients for changes, indicating that the patient is getting better or worse. And they must be in constant communication with the nurses to report those changes quickly. CNAs will keep the room neat and tidy. Since a lot of doctors, nurses, therapists, phlebotomists, dietary aides, and others are in the room often, it can get a bit messy. CNAs answer call lights when a patient needs help. Patients in a hospital are the sickest type of patients, so they need a lot of help. Numerous call lights going off is normal. Hospitals have different departments, or floors, that specialize in different types of care. Most people are familiar with the emergency department, but there are many other nursing floors in a hospital, each with its own function. For instance, there are nursing units that specialize in care after hip or knee surgery. This is called the ortho unit. And there are some units that specialize in the care of stroke patients and other traumatic brain injuries. This is called the neuro unit. There are units that specialize in the care of heart patients called the telemetry unit, and cancer patients require special care provided in an oncology unit. There are units that specialize in the care of patients giving birth, called obstetrics or the mother-baby unit. And the list goes on, but not all hospitals will have all departments. Some entire hospitals even specialize in one single type of patient, like a children's hospital or a cancer center. But most hospitals will have several units, each devoted to a specific type of patient. And the care each type of patient requires will be completely different, which means that the tasks CNAs would do in each unit will be different. For instance, if you are working on an ortho floor, caring for hip and knee surgery patients, you might be helping patients with a bedpan a lot because they can't get out of bed. But if you are on a telemetry floor, taking care of heart patients, you may rarely use a bedpan because most of your patients are able to get out of bed and use the bathroom. If you are working on a neurology floor with stroke patients, you might be helping 8 patients feed themselves. But on a mother-baby unit, you would only deliver food trays at meal times because they can eat just fine by themselves. The type of care that a CNA will do on each unit will be different because the needs of the patient are different. So even within the same hospital, two CNAs are not doing the exact same skills. You would have to perfect the skills that your unit requires the most. If you are the type of person that enjoys working closely with a team in a fast-paced, noisy environment, if you are easily bored and like constant change, and you perform well under pressure, then a job in a hospital might be just right for you. But sick patients can't stay in a hospital forever. Patients are only in a hospital long enough to stabilize and develop a treatment plan. Most long-term treatment will occur somewhere else. When a patient gets discharged, they usually go to one of 3 different places. Most people go home after leaving the hospital, but some will go to rehabs and others to nursing homes. Home is wherever the patient lives, whether it's a private home, an assisted living facility, a jail, a nursing home, wherever the patient lives at the moment is home. We've already talked about home, so let's talk about rehabilitation centers now. A rehabilitation center focuses on restoring the patient to the highest level of function possible. In this setting, patients are generally recuperating from illness, serious injury, or surgery. These patients need nursing care, so nurses and CNAs work here. Patients are generally required to participate in various therapies like physical therapy as well. These patients will require a higher level of care that should diminish as the patient recovers. So some patients will need extensive help with everything, while others, closer to discharge, will be able to do more for themselves. These patients tend to stay for several weeks to a few months while they recover. CNAs that work in this setting find a good mix of activity that prevents boredom, with patients that stay a little longer so that the CNA can develop a routine. Admissions and discharges will be less frequent, but often enough to mix things up for those that like change. These patients will need help with some or all daily activities, such as bathing and grooming, but some will be less dependent. But it's not all personal care here. There are plenty of nursing activities to help out with too. Rehabs offer all the variety of the hospital at a slightly slower pace. If you like the satisfaction of watching a patient progress, enjoy both routines and variety, and want to perform both personal care and nursing tasks, this might be the right setting for you. But not all patients are expected to get better, even with therapy and nursing care. Some patients will require long-term nursing care for conditions that just aren't going to get any better. For those patients, rehab just doesn't make sense. Patients that need long-term nursing care for medical conditions that are not expected to improve may go to a nursing home. Nursing homes are staffed by nurses. That's because the patients here need nursing procedures. Things like wound care, tube feedings, medications, frequent monitoring, etc. And nurses need helpers, which is where CNAs come in. Nursing homes will have patients that can't live at home because they need extensive nursing services, but aren't appropriate for the hospital because they're stable. Hospitals provide short-term treatment. Nursing homes are a longer-term solution. These patients may need a lot of help. They will usually need assistance with at least some personal care tasks, if not all. But these patients are often at risk of worsening rapidly, which means that all staff members must be vigilant for changes and report them quickly. So CNAs in this setting must have excellent observational skills. Patients in nursing homes may stay for a short time until other arrangements can be made, but most patients are there for months or years. And for many patients, this will be their final home until they pass away. CNAs in this setting must be compassionate, friendly, and ethical. You will be working with nurses, but not as closely as in a hospital because there aren't as many changes to report. This setting is ruled by routines. Patients get up at the same time each day and maintain a set schedule for the most part. If you like caring for the same residents for long periods, working with a team, and enjoy spending time with the elderly, and take pride in providing personal care, but still want to assist with nursing procedures that you won't see in home care or assisted living, then working in a nursing home might be right for you. Some nursing homes have special areas for dementia patients. Working with dementia patients can be challenging and requires a lot of patience. There are many forms of dementia, and each will have different characteristics and behaviors. If you're interested in this work environment, CNAs would benefit from additional training on dementia. When a dementia patient is having a crisis and is combative, lashing out, hysterical, or delusional, they may be transferred temporarily to a mental health facility to be stabilized and for medication management. Mental health centers usually offer both inpatient and outpatient care. That means that stable patients come in for treatment visits, just like other doctor's appointments. But unstable patients are admitted for a certain period of time for crisis counseling or medications. These centers also offer inpatient treatment for addiction counseling and detox. CNAs can work in mental health centers, assisting nurses with patients in crisis and patients undergoing detox. Some of these patients are able to provide all of their personal care needs with a little encouragement. Other patients may need assistance with personal care, such as bathing or grooming, while in crisis. Most facilities provide short-term care, usually only lasting weeks or months, although some longer-term settings are still in operation. CNAs that work in mental health settings usually provide less physical care and more psychological care, encouragement, and helping patients establish healthy routines, although some personal care skills may be required by some patients. CNAs in this setting must be patient, firm, and able to spot manipulative behavior. After stabilization, patients will often return home or to the facility that they were at before treatment. Most patients will need routine medical care and follow-up visits. This is usually done on an outpatient basis. Most healthcare is outpatient. Doctor's offices, walk-in clinics, lab work, x-rays, same-day surgery centers, dialysis, outpatient therapy. All of these are examples of outpatient care. People at home, residents at assisted living facilities, and even some nursing home patients have to occasionally receive some sort of outpatient care. And these are all settings where a CNA might find work. Some doctors' offices will hire CNAs to take vital signs and help with procedures. Some dialysis clinics hire CNAs and provide additional training to help nurses with dialysis. Some labs and radiology centers hire CNAs to help with clerical tasks and perform other skills. Every state is different and has different laws and regulations, but anywhere a nurse is working, a CNA is usually needed. Remember that CNA stands for Certified Nursing Assistant, so if you can help a nurse in a hospital, you can help a nurse anywhere. The tasks you would do for each setting will differ greatly, based on the needs of those patients. And you probably won't do much personal care in an office setting. Most of these opportunities will require learning additional skills specific to that setting. If you aren't afraid of learning something new, take a look at opportunities in outpatient settings. They often offer great opportunities for CNAs looking to branch out a bit. So as you can see, we have covered quite a few patient care environments that a CNA can work in. Each one will have specific types of tasks that the CNA will perform, and each setting is different. There are opportunities for every type of CNA, those that like fast-paced environments and those that prefer a slower option, those that prefer a lot of variety and those that prefer routines, those that like working closely with nurses in a team environment and those that prefer working with less supervision, those that enjoy performing personal care and those that prefer more clinical tasks. What type of CNA will you be? Don't be afraid to try a few different settings on for size until you find the one that fits you perfectly.